Hi everybody, my name is Beverly and I have just returned home from having blepharoplasty surgery, which is the upper eyelid. I had that done with Dr. Sam Lamb and he's located in Plano. I have to say I put this to the side for about a couple years because I was a little nervous. I've heard horror stories about eyelid surgeries and brow lifts, and I just wanted something that was going to be a natural appearance. And I am totally pleased that I went through with this. I'm an hour out. I've returned home from the surgery, and one of the reasons I think I was hesitant is all the stories you see, pictures you've seen of maybe work that wasn't properly done or just a little excessive. But I like Dr. Lamb's approach. He's more conservative and they do it under local anesthesia. So believe it or not, there was very little pain. I went into the office at 12:30. They numbed my upper eyelids with some numbing cream on both sides. I let that sit in for about 20 minutes or so, and then they take me back to the room, the surgical room, and basically he uses a local anesthetic. And the way he does his injections are relatively pain-free, honestly. I felt little pinches, but not very much. So once he did the local anesthesia, he started cutting away, as you can say. He marked, of course, where he was going to cut, but I tell you what, the incisions and the procedure and the suturing took about 20 minutes, maybe 30 minutes total for both eyes, and I would do this again. This was so painless, and already I can see the skin that he took out. The suturing, I don't know if you can see, to me, looks pretty good already. I had one eye, this eye right here, had a little bit more skin, and so my eyes are a little asymmetric, or not asymmetric, I should say, so they're not going to look perfect because I didn't have perfect eyes before. But my main objective is just to get that extra skin that was very heavy on my eyes and basically made me look older. I'm 56, so I realized Mother Nature's going to do its thing, and I just felt like I wanted to look refreshed. I wanted it to look natural. I didn't want the brow lift that, or the stretched out eyes. So I love Dr. Lamb's conservative approach. And he listens to what you want, so that's important when you pick a plastic surgeon. So anyway, this is day one. I'm going to do a diary and just let you know how it looks each day. But right now, I just am experiencing a little bit of burning. I'm using an ointment that they give you, and also I'll use an ice pack every 20 minutes. And then of course I'm using an arnica pill, and that's just to maybe prevent a little bit more bruising. So bruising and swelling, which is normal for this procedure, and everybody's different. But I thought if this could help, I would definitely try it. So they sell this in the office, or you can get it at a herbal store. So yeah, and maybe I'll take some Tylenol for pain, but I don't need anything stronger for that. So far, so good. So anyway, this is day one, and we'll see you tomorrow. Thank you. Hi everybody, it's Beverly and it's day two after my blepharoplasty, which is my upper eyelid surgery that I had with Dr. Sam Lamb. It's almost 24 hours since I've had the procedure, so I thought I would just go over everything that's happened since I spoke yesterday. I slept fairly well. I didn't need anything for pain, so I had a pretty good night's sleep. I did have to sleep elevated, so I made sure I had plenty of pillows and pretty much slept straight up. Nothing for pain. I did put on the ointment that we'll use twice a day. This is an antibiotic ointment that they prescribe. This one is called mupirocin ointment, and I just put it on with a Q-tip twice a day on the incision. And also I, of course, continue to use the ice packs. So what I did is I put gauze over my eyes like this, and then I would put the ice pack on and let it sit for 15 to 20 minutes. And pretty much went to bed fairly early, and like I said, I slept really well. This morning I woke up, no pain whatsoever, which is crazy. I thought for sure I'd be in pain since I really didn't take pain meds, but no pain, which was wonderful. Hardly any swelling, hardly bruising. It looks like it's starting to swell on the inner part of my eye. And I don't know if it's going to continue to get worse. I'm thinking tomorrow might be my worst day, but I will keep the diary going and show you what it looks like. But so far, I have to say, I'm pleasantly surprised by the pain, the lack of pain, I should say. And I haven't had itching, no irritation. The only thing I recommend is that you just keep your hands away from your eyes. I looked in the mirror and thought it was an eyelash, and of course it was a stitch. So try to keep your hands away from your eyes. Don't look. It was a stitch that was pretty much on the corner of my eye, and I guess I was out of it yesterday, but almost pulled it. So you don't want to do that. But honestly, I have to say that the experience so far is better than expected. So yeah, I'll just keep tracking, doing a diary until they take the stitches out, which will be a week from yesterday. So next Thursday, I'll get the stitches out. Hopefully this is the most of the bruising and swelling, but I know I've seen pictures of severe bruising, so I'm going to keep my fingers crossed and continue to use this Arnica Montana. So I've been taking it as prescribed. The directions are on the back of the package, so I've been following that. So hopefully that's been helping. Anyway, like I said, I'm really pleased so far, so I will check back tomorrow. Thank you. Hi, so today is Saturday. This is 2 days after my upper lid surgery with Dr. Sam Lamb. And today I'm doing really well. I don't see a lot of increased swelling from yesterday. I still have some from the inside of both eyes. And honestly, it really just feels tight today. There's no pain. I slept well last night. I really don't see any issues today. I did take a shower last night, and some of the blood, the dried blood, did come off. I was trying to be very cautious about getting the incisions wet. But tonight, I think when I take my shower, as I wash my hair, I think some of it will fall off, but I'm still going to be careful. But other than that, I don't have a lot of swelling. I don't have a lot of bruising. I'm really pleased with the progress so far. I'm hoping that this is the worst of the worst. So anyway, I will let you know what it looks like tomorrow. Hi, today is Tuesday, and I believe I mentioned that I will get the stitches out Friday, but actually it's Thursday, so it will be 1 week on Thursday and 2 more days, and they'll take out the stitches. Honestly, I'm doing really well. I would recommend this procedure to anybody that might be a little nervous, a little hesitant. It's been a wonderful recovery. I think I did have a little reaction to the ointment, and so I switched to Vaseline. But other than that, I've had very little swelling, very little bruising as well. So other than a little bit of itchiness and a little bit of dry eyes, it's been going really well. So I'm just anxious to get to Thursday. So I will see you then. Thanks. Hi, today is Thursday. It's been 1 week since the procedure. So I'm on my way to Dr. Lamb's office to get the stitches out. I don't have any makeup on my eyes, and there was a little bit of swelling, and just a little bit of bruising, but all in all, it's not bad. So anyway, I'm really excited, and I'll try to put in before and after pics. So anyway, anybody interested in the procedure, go for it. All in all, it's been a pretty positive experience, except for a little bit of swelling and a little bit of bruising. And maybe a little bit of itching, and I believe that was due to the ointment. So anyway, I'm excited to get the stitches out.